what your calcium score heart scan really means. Have you ever wondered what's really going on inside your heart's arteries? For decades, doctors have relied on indirect clues: cholesterol, blood pressure, family history. But what if you could get a direct look at your heart health, long before any symptoms appear? What if you could actually see one of the most powerful predictors of heart disease? This isn't science fiction. This is the power of a coronary artery calcium scan, and understanding what it shows can be one of the most important things you ever do for your health. Just got your calcium score results back and feeling a little lost or even worried? You are definitely not alone. It can be jarring to see a number that represents your personal risk for the leading cause of death. But here's the crucial point I don't want you to miss. A calcium score is not a sentence. It's an early warning. It's a wake-up call that gives you the power to take control. In the next few minutes, we're going to use this 3D animation to show you exactly what your doctor sees, explain what that number really means for your heart, and most importantly, talk about the proactive steps you can take to live a long, vibrant life. What is a calcium score heart scan? So what exactly is this test? A calcium score heart scan, also called a coronary artery calcium or CAC scan, is a special type of CT scan that does one specific job. It detects and measures calcium in the arteries that supply blood to your heart. When we talk about plaque in the arteries, we're talking about a buildup of fats, cholesterol, and other gunk. At first, this plaque is soft, but over time, as the process of atherosclerosis progresses, the body tries to wall it off and it calcifies. Think of it like this. Healthy arteries are smooth and flexible, like new pipes. As plaque builds up, it's like rust and scale accumulating inside those pipes, making them stiff and narrow. The calcium is what makes this plaque visible on a CT scan, appearing as bright white spots. The scan itself is simple, quick, and non-invasive. You lie on a table that slides into a donut-shaped scanner, but your head is usually outside the machine. There are no injections or dyes. A technician will place a few EKG electrodes on your chest to sync the images with your heartbeat, which makes sure the pictures are crystal clear. You'll just need to hold your breath for about 10 to 20 seconds at a time. The whole thing is typically over in about 10 to 15 minutes. What the scanner gives us is a series of detailed images of your heart. A computer then analyzes these images to calculate your total amount of calcified plaque. The result is given as a number, called the Agatstim score, or simply your calcium score. This score is a direct measurement of your plaque burden, the physical evidence of atherosclerosis in your body. It provides a transparent window into your heart's health. Who is the test for, and who it's not for? This brings us to a critical question. Who should be getting this scan? Since the CAC scan is a screening tool, its greatest power is in helping people who do not have any symptoms of heart disease. It's designed to unmask hidden risk. Current guidelines recommend the scan for asymptomatic adults between the ages of 40 and 75 who are at a borderline or intermediate risk for heart disease. This might be someone with risk factors like borderline high cholesterol, high blood pressure, a family history of heart disease, or diabetes. For these individuals, a risk assessment can land them in a gray area. A calcium score acts as the perfect tiebreaker, clarifying their true risk and helping them and their doctor make a more informed decision about treatments, like whether to start a statin. It's just as important to understand who this test is not for. If you are already having symptoms of heart disease, like chest pain or shortness of breath, a calcium scan is not the right test. Your doctor will likely recommend a different evaluation, like a stress test or a CT angiogram, which can look for actual blockages. Likewise, if you've already had a heart attack, a stent, or bypass surgery, you don't need a calcium score. The test is meant to find out if you have disease. In your case, you already have a confirmed diagnosis. The focus for you is on aggressive treatment, not initial risk assessment. Finally, it's generally not recommended for very low-risk individuals, as the odds of finding anything are very low. The real value is for the millions of people in the middle who may not realize they are on a path towards a heart attack. Interpreting your score from 0 to over 400. Once the scan is done, you'll get that all-important number. The score can range from 0 to well over 1,000. Let's break down what these numbers mean, because your score isn't just a number, it's a roadmap. A score of 0 is fantastic news. It means no detectable calcified plaque was found in your coronary arteries. This indicates a very low risk of having a heart attack in the next several years. A 0 score is so powerful, it's often called the power of 0, providing a kind of warranty against a cardiac event even if you have other risk factors. A score between 1 and 99 is a sign of mild plaque buildup. This means there is definite early evidence of coronary artery disease. Think of this as your wake-up call. It's an opportunity to get serious about your health and make lifestyle changes before the disease gets worse. For scores in this range, especially for those over 55, starting a statin may be reasonable. A score between 100 and 399 indicates moderate plaque buildup. This is where things get more serious. A score in this range means a significantly increased risk of a heart attack. At this level, guidelines strongly recommend starting a statin to lower your LDL or bad cholesterol. For those at high risk, the goal may be to get LDL levels below 70 milligrams per deciliter. In some cases, a low-dose aspirin might also be considered to reduce the risk of blood clots. This number from your scan empowers you to have a specific, evidence-based conversation with your doctor about a plan tailored just for you. Limitations and a message of hope. Now, it's important to be real about what this scan can't do. The scan only detects calcified or hardened plaque. It cannot see the soft, non-calcified plaque, which can also be dangerous. This is especially true for younger people, where plaque hasn't had time to harden yet. So it's possible, though less common, to have a 0 score and still have some underlying disease. That's why your score should never be viewed in a vacuum. It's one piece of a larger puzzle, along with your cholesterol, blood pressure, blood sugar, and family history. It's also crucial to know that there is currently no proven way to lower your score. Once the calcium is there, it's there to stay. So repeating the scan frequently isn't usually necessary. The goal of treatment is not to make the number go down, but to stabilize the plaque, prevent new plaque from forming, and dramatically lower your future risk of a heart attack or stroke. A high score shows you at high risk, and that fact doesn't change. What does change is what you do about it. The journey to understanding your heart health can feel complicated, but the coronary calcium scan offers a moment of incredible clarity. It turns risk from an abstract idea into a tangible number you can see and act on. It's a personalized look at your own biology. If you're a man over 40 or a woman over 45 with risk factors for heart disease, the most important call to action is to talk to your doctor. Ask them if a coronary calcium scan is right for you. That conversation could literally change the course of your health for decades to come. This test is more than just a scan. It's a second chance. It's the knowledge you need to turn a potential crisis into a story of empowerment. This video is for educational purposes only and is based on current medical guidelines and research. It is not a substitute for professional medical advice. You must consult with your physician or another qualified healthcare provider to interpret your results in the context of your personal health and to create a tailored treatment plan.